Our next speaker is Dr. Francois Tessier. Dr. Tessier is an energy healing therapist and a quantum touch practitioner. He has a level 5 certificate in spiritual and psychic program granted by the International College of Spiritual and Psychic Sciences, Canada. Dr. Francois masters many energy healing modalities: pranic healing, quantum touch, quantum healing, Reiki, Barbara Brennan healing system, energetic harmonization, theta healing, and many other complementary energy healing tools. He is a lecturer at the International Institute of Integral Human Science, Canada. I cordially invite Dr. Francois Tessier to deliver his speech.
Hello, sorry. Hello, everybody. Do you hear me? You hear me? Yes, I suppose that.
Yes, yes.
Oh,
We can hear you, sir.
very good. Good afternoon or good night, depending on where you are on the planet. Congratulations, Dr. Deborah. Very interesting presentation. My name is Dr. Francois Tessier, and I'm in a different field. So I am very happy to I've been invited to this seminar, because I work in the field of energy healing therapy. And you guys are physiotherapists. So you think, what is that? What is an energy healing therapist doing here? Well, in fact, my goal is to demystify what is energy healing, because there is I would say, misunderstanding of what we are. And I would just like to explain what we do. As for my credential, right now I live in Sri Lanka. I'm a Canadian citizen. I live in Sri Lanka. And I am the Dean of the Faculty of Integrative Medicine of AUGP in Sri Lanka. And I'm also the CEO of the Center for Complementary Therapy and Education. So right now, my job is an educator, right? So I don't need to share the screen. I just need to do this. I guess that you can see my presentation. You can, right? Right. So as an energy healing therapist, we work with something that for the scientific community may look as unscientific. So I would like to just state that at the beginning of my presentation, but it is having a scientific approach, right? Since the, I would say, last 25 years, now we can record around 600 to 700 research published in different modality of energy healing. And it is very small compared to physiotherapy, but this is a start for us to be integrated into the scientific community. Is an honor, because we consider our approach as very scientific. In fact, we are not, many people here in Sri Lanka believe that we are among the faith healer movement. This is not about the faith healer movement. We are not replacing the classic Western medicine. In fact, we work with other specialists such as physiotherapists, acupuncturists, right? We work with other approaches in classic Western medical approach as a complementary approach to the classic Western medicine. So we are not replacing it. We work with osteopath, we work with chiropractor, and sometimes we work alone also. We can also work alone. But when we are complementing the work of other classic Western approaches, the speed of recovery is much faster. We are improving a lot the health condition of the patient, right? We are not medical doctors. So energy healers, energy therapists are not medical doctors. We are not emitting any diagnosis. Most of the patient that comes to see us, most of the patient that comes to see me received already this diagnosis from a medical doctor or from a physiatric doctor, right? So we know exactly what they have. We do not have exactly the same knowledge as a medical doctor, yet we understand the anatomy, but not to the same extent that the medical doctors and the physiotherapist does, because we're not doing the same job, right? You will understand along the way why I'm telling this. This is a drug-free approach. We are not delivering drugs, tablets, herbs, and nothing, not even a glass of water. We know that drinking water is very important, but we are not allowed as a therapist to prescribe anything. In fact, we are non-invasive, right? So no prescription is done during the course of our treatment sessions, right? There is no massage. There is no manipulation. There is no body manipulator, okay? We are using our hands, but we are not using massage manipulation such as chiropractors, such as physiotherapists, such as osteopath may do. We are not using this, okay? You will understand what we are doing then. You may think, what are you doing, right? We're doing something different. In the field of musculoskeletal pain and problems, empirically, there is a lot of, I would say, cases that were presented to me and that were presented to my instructor, which we could treat in conjunction, in complement with physiotherapists, acupuncturists, with also all other specialty, with very good results, like such as cervical subluxations, other subluxations of the spine. Scoliosis has been treated in a very, very efficient way. This herniation, we could get a very good result, and without surgery, right? It takes a lot of time. It takes like 15 to 20 sessions, but without any surgery, we could achieve the result of almost terminating the problem. Sometimes with the help of chiropractor, sometimes without, right? Lumbalgic pain, lumbago, we could achieve a lot of minimizing of the pain, which sometimes could be, I mean, very painful. You know, lumbalgic pain on the lumbalgic area is very painful, right? So the pain management of the lumbalgic area is very efficient with energy healing, right? Joint problems can be addressed with energy healing, such as sometimes I had some patient in the past that had no more cartilage, and so the bone were touching each other. A lot of pain out of that, so we could manage the pain in a sustainable way. Of course, these patients have to be receiving a surgery to place some replacement from the cartilage. But sometimes the surgery can wait for many months, many weeks, and many months. Meanwhile, with energy healing, we could achieve the goal of minimizing or eliminating completely the pain, right? Arthritis. A lot of cases that came to me or came to my instructors with rheumatism or arthritis, even chronic arthritis, were successfully addressed with energy healing. Sciatica, right? Sciatic nerve. And sciatic nerve can be on one side or both sides. A lot of patients that came to see us could see real, concrete, measurable result out of energy healing session. Strained muscle spasm can also be addressed, etc. So you can see that there is a lot of things that energy healing is very useful and very less known by the scientific community, right? There is right now a couple of doctors that are following the training and are themselves are using in conjunction with their own practices energy healing. For example, classic Western medical doctor, generalists are using energy healing in conjunction with their existing practice, right? Physiotherapists and chiropractor are also among the people that like to train themselves into energy healing therapy because they can continue their own practices and they can combine it with some energy healing techniques and accelerating the pace of healing of their patient in a very important way, right? So energy healing can be considered as a holistic medicine because it's holistic in a way that it addresses the whole person, right? It's not only addressing, it is also addressing a very focused problem. For example, sciatica problem is a very focused problem, right? It is located in a very specific area, but there is interconnection with the body, mind, spirit aspect of the person. And the more we go, the more science is in understanding the role of the non-physical aspect of all of these problems, right? For example, the cervical problem can be caused by the compression of when the patient is lifting the shoulder because of the stress and because of emotional pain for so many years. So in fact, there is a compression that is done on the cervical. So there is definitely an emotional cause that is leading to a physical cause. In energy healing, we are a holistic medicine that is combining the body, mind, spirit approach. And you cannot disconnect the body from the emotions, right? And this is our belief system. We strongly believe that most of the physical condition has in a certain percentage, I would say, a body-mind connection, right? So energy healing is very old. It's an international approach. It's intercultural approach. Every culture in every part of the world, my country, I am Canadian, and the native people are very much connected to energy, the universal energy. This is how we call it, like this. They are naming it differently, but this is, and if you travel around the world, you will see that there is a lot of culture in their history that is using energy healing, right? It is also a science. I've done research about energy healing. I got my PhD by doing some research, and we can empirically measure the impact of the energy healing treatment, right? We can empirically see that energy healing do a difference on patients, right? We are using something that I cannot show you. We have no device. We have no tablet. We have nothing such a way. We cannot show you with our hands, this is energy. I cannot open a box and show you the energy, unfortunately. But we can definitely, when we train the therapist, we train them to perceive in a way the energy and to use it in a clinical realm, right? In fact, energy healing is a long forgotten tradition, because in the 19th centuries, the allopathic medicine started to take over the treatments, and all the natural approaches of healing were overshadowed. But all the natural medicine, especially the energy healing, resurfaced in the 20th century, and several approaches in energy healing were rediscovered and reorganized into more organized manner, because previous to the 19th century, it was not such, there was no name for it, right? It was not such an organized modalities. So the organized modalities, such as quantum touch, such as Reiki, such as pranic healing, pranic energy, and so on, did not exist. It did not exist because there is instructors that studies and that organized a system, and they gave name to it, right? But previously, it was not existing like that. Right now, in the, I would say, new age people, energy became a buzzword, and it was used out of context. So it is very difficult for us to promote the scientific approach that we are. So my personal mission is to demystify the energy, demystify what is energy healing, and what is this phenomenon, and how does it work? How can we use it in clinical, in clinic with real patients, right? And I train, my job right now is to teach people to use it in a scientific way in clinical aspect. And at the university, we are now promoting students to do some research. So research are going to be published in the coming months, but right now we are trying to help students to organize their knowledge into very organized research, right? Okay. So these are the modalities that I have learned. I have been trained for many years in Canada and in United States. And I took this training in a very serious weekends training. These are very intensive trainings where you learn a lot about history, a lot about the theory behind the energy, what is energy, and then the techniques, and then I would say the treatment plans, and so on, right? So these are pranic healing, pranic energy, Reiki, quantum touch, quantum healing, theta healing, Barbara Brannan healing science, energetic harmonizations, and so more. So there is a lot of different modalities. They are using energy, each of them in a very different way. And so I personally combine it in what I call intermodal approach to better suit the needs of each patient, right? Okay. Okay, so what I teach is energy is a scientific fact. I know that there is a lot of skepticism in the scientific community. I respect this skepticism, but there is studies. There are number of growing studies that are published. Now, at least as compared to before, it's a little bit like acupuncture. If you go back in the 90s, acupuncture was considered as fake science. Today, well, there is over 6,000 or 7,000 studies demonstrating the efficiency of acupuncture, right? So it is the same thing for energy healing. Now we are at the stage where scientific community is telling us, start your research, peer-reviewed research, right? So that we will understand that you are not into the paranormal and super paranormal and, you know, faith healers and so on, which is not the case. It's not a belief system. It's a scientific fact, right? There is also in the community of energy healers, scientists that are working in the field of fundamental science, because there is a lot of studies of empirical science, like myself. I've studied the use of energy healing in multifactorial disorders. And I just studied the impact of the treatment. There is other scientists that are searching the fundamental aspect. And there is a lot of studies going on, so it is going very fast. So as compared to before, right? Okay, so what are we doing? What is the natural gesture when we experience pain? When human experience pain, right? We are using the hands. This is international. This is natural. This is something that everyone is doing naturally. Why? What happened? What is the reason? So just by touching the pain area, something is happening, right? And it's beyond just the human comforting, right? It is beyond that, right? Because in your hands, in the hands, there is energy centers. There is what we call them the chakra system, right? The chakra system have been created by yoga, right? But we are actually discovering in different modality that the chakra is projecting the chi, projecting the ki, projecting the energy, right? Projecting the energy, and we can actually use the hands. We are actually using our own chi, our own energy. And when we are putting the hands on the energy on the body parts, there is some relief that the energy flow naturally out of the hands without thinking. This is a natural phenomenon, right? So the therapist, of course, has a bigger amount that can flow out of their hands because they are trained in order to accelerate the flow of the energy that comes out of their hands. But naturally, every human being that is putting the hands on a pain area Well, this is because there is something that comes out of the hand, and it's a natural phenomenon, right? And this is how it is represented by what we cannot see actually, the energy, but this is how it is actually happening. In the palm of the hands, in the center of the palm of the hands, there is a big energy center that projects a lot of energy. And on the tip of each of the finger, there is also smaller energy center that are there, right? And we are using this. We are using our hands. We have no other devices than the hands, right? And it works. Well, the question that you may have in mind right now is, what is it? When you're talking about energy, what is that? Okay. As I said to you previously, there is many names, or there is many tradition around the world. In fact, there is 76 names. We identified 76 words to name the energy, right? The Greek are talking about the pneuma, the Polynesian people are talking about the mana, the Hebrew, the ruah, the Hindu, they call it the prana, the shakti. The Chinese are talking about the chi, the ki. Japanese are talking about the ki, the Chinese about the chi. And the scientists, we are using the bioplasma or the energy. But there is many words, right? In fact, energy is a life force. It's a fundamental life force, right? And it's everywhere in the universe. It flows through all and everything that's around us. We are actually bathing in a sea of energy, of universal energy. And it's a fundamental force. Human, plants, and animal, we feed out of this energy. So if we don't have this energy that comes in, our physical body becomes weaker, right? Or we experience pain. We can experience not only musculoskeletal pain, but other physical pain. We can experience pain if we do not have these sources of energy, right? And this is not electricity. This is not magnetic energy. This is not kinetic energy. This is not atomic energy. This is not thermal energy. Actually, right now, unfortunately, there is not yet unit of measurement of the chi. Okay, I will be very frank. There is no unit of energy, but as I said, the fundamental researchers are working very hard to understand what is going on. Why can we experimentally see some differences, but we cannot actually put a unit of measurement? So there is some researcher in California that are working in some university to try to understand that, right? It will come, but right now there is not, right? In fact, the energy that we're talking about is not healing, it's a catalyst. The energy, in fact, is restoring the balance. It's like information. The energy, the universal energy, is entering our body, and it acts like a spark plug. It is not itself doing the healing, but is opening a program that is already in our body that we call self-healing. All human body and animals, you can use energy healing for animals as well, and they don't have opinion, right? There is a lot of energy healing therapy, and in fact, they are using the energy, and the natural capacity of the body is that's a program, and is starting, right? So what we are doing, energy therapists, is that we are cleaning congested prana and we are energizing the affected part with prana, with the chi, with the ki, right? And all of a sudden, the energy flows, and the same phenomenon into the biological, the physical aspect also flow, right? So the flow of energy and the flow of the body fluid starts to happen again. So the chi flow effortlessly in nature, right? And it's independent of belief system. You don't need to believe in water to drink it. And speaking of which, I will drink a little bit because I need. It's independent of belief system, and the body naturally attracts the chi, the prana, the energy. And when we attract this energy, we transform it, and it is distributed into the body to maintain the health, right? And the chi, the ki, the prana can be then attracted, transferred, stored, programmed, project, and released. These are the basic things that we teach to the graduate students that are learning this modality. We teach them how to attract more, to transfer more, to store like a battery, and to program, because energy is information, right? And so we can program, we can project and release this energy, right? The chi respond to will. What does it mean? The chi respond to the intention. It's a little bit like when you drive a vehicle, you want to turn right, all your body is involved into turning the vehicle right. That's the same thing. We train the therapists to use their intention to direct where the chi is going to be projected, and it works. The chi is going to exactly the right place that the therapist is showing to this energy. It responds to will, it responds to command and instruction, right? This is the basic thing that we are teaching to the interns. So energy, the therapist in fact is not using his own energy. The therapist is a receptor of the universal energy. So the therapist is not using his own energy, because he would die basically after one or two patients. No more energy is there, so the therapist would completely die, right? So we are teaching specific, very numerous hands gesture, hands posture, breathing techniques, visualization to treat the ailment, chase the pain, and effectively address the physical condition, whether it's in the muscle or the skeleton, and sometimes other organs, to decrease acute pain and to reestablish the balance, right? And when we work in conjunction with physiotherapists, you really speed up the healing of the patient, right? In a very big factor. Okay, pain in the energy standpoint of view. You know, in the physical body, there is free circulation of the fluids. And when these fluids can freely circulate into the body, well, you feel it can be the blood, the lymph, the glandular secretions, the synovial fluid, the cerebrospinal fluids, etc. Well, all of these fluids has to freely circulate into the body. The free circulation of the energy promotes health. If the energy, the prana, the chi, the ki does not circulate, it means that there is stagnation, there is crystallization and pain, inflammation, disease of the physical body, right? So the energy body map what happened in the physical body. There is a direct link into those two. It is not separated. They are very much connected, right? There is a cellular energetic connection between the energy bodies and the physical body. And also right now, this is what the scientists are looking at. They are looking at how prana affect cells, right? There is a lot of studies about that going on right now. Okay, so there is, like I said, the direct interaction between the physical and the non-physical. The condition of the physical body reflects exactly on the energy body. It means that if there is a subluxation in a vertebra, or the area where you have a sciatica, or the area where you have like a scoliosis, for example, you have automatically energy congestion that is there. And we can feel it. We are trained to feel. We are passing our hands and we can directly feel that if we pass our hands on this area as compared to another area, there is a congestion of energy, right? If there is like a disc herniation in the lumbalgic area, for example, we can feel it directly, right? So there is a direct connection of the physical and the non-physical body, right? When we do an intervention on the non-physical body, automatically we are doing we are also impacting on the physical body and vice versa. So this is not disconnected. This is very much connected, right? There is two phenomena in general that we can see in energy. There is congestion or depletion. Congestion means that the energy is congested, crystallized. For example, if we see arthritis into the articulation, right? Arthritis around the knee, for example. If we scan the energy around the knee, we will feel that it is hard, it is blocked, right? If we unblock, if we remove this blocked energy, and if we facilitate the recirculation of the energy into the arthritis knee, the pain disappears, right? And I've seen it so much different. Even a chronic arthritis can be treated in conjunction, again, in conjunction with what the physiotherapist can do, right? So if we are working together, we are really, really speeding up I would say the recovering of the patient, right? So we remove the blocked energy and we replace it by healthy prana, and we facilitate the circulation of the energy, and the pain level minimize, the inflammation minimize, and so on, right? Basically, we are using two different techniques. We have two great category of techniques. We have hands-on techniques where the hands are physically in contact with the body of the patient to project the energy, but we are not doing manipulation like chiropractor. Absolutely no manipulation is done. There is no massage. Sometimes a minimal contact with the body suffices. Then we can project the energy for a certain period of time. Most of the time, this is like 60, 65, 70 minutes treatment sessions that we are giving to the patients, right? So there is hands-on techniques and hands-off techniques. No physical contact at all with the patient's body. And that may surprise you, right? Because you are a physiotherapist, you are really working with the physical body. But I'm telling you that working around the area where the pain is located, removing the energy, you can see in the face of the patient in real time, the pain reducing, 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 and reducing again and again and again, right? So there is hands-on and hands-off techniques that are used. The trained therapists that are finishing the full training with me, they really can help with spine, hip, shoulder, atlanto-occipital, cervical, and sphenoid bone. Sphenoid bone, particularly, as you know, is inside of the skull, right? And for acupuncturists, for physiotherapists, for osteopath, for chiropractor, it's very difficult to access because it's in the middle. It's in the middle of the skull. And so it takes a lot of work for osteopath to make some adjustment. And as you know, the sphenoid bone is directly connected to the spine, and the sphenoid bone, if it's not adjusted, it can impact on the spine from the Atlas to L5, right? So by certain technique, by hands-off technique, so it means without touching the physical body, we can adjust the sphenoid bone, and it directly impact the atlanto-occipital area. And sometimes we even hear, like when chiropractic treatments, the cracks, you know, we can hear the bone adjusting alone. And the patient are very surprised. They're telling me, what happened? You didn't touch me. I said, no, of course. But there is some physical movement going on, right? So, and we can also adjust, we can adjust the unfit hips and shoulder, because sometimes there is uneven hips, and this impact a lot on the spine from L5 to Atlas, right? Because if the hips are not adjusted, they're uneven, there is, of course, it impact a lot into the full spine, from the full spine, from A to Z. So with running energy, with hands-on or hands-off technique, we can really make a difference into adjusting the hips, and it is, I mean, sustainable. I have patients like dancer or athletes that are having the hip unadjustment. The hips is uneven, right? And with 1 or 2 sessions, the hip is adjusted and becomes even, and it sustains 6-7 months later. They come to see me telling, you know, my hips is still very much even. I feel different when I walk, right? So see, so there is concrete evidence that energy can do a difference. So in general, energy healing treatment increase the sense of physical well-being, and sometimes, most of the time, emotional well-being as well. Because as I said at the beginning of that presentation, there is an emotion and body, mind, spirit connection between the physical condition and the non-physical condition. So there is stress, the minimization of the stress, so that the patient stretch less the muscle, and suddenly the physical well-being is sustained, right? We are not only impact on musculoskeletal body, but we can impact on many other ailments, such as migraine, respiratory problems. I've seen in a very fast way. When I first arrived in Sri Lanka, I came in 2020, 2014, and I gave a lecture at the university, and there was, he could not breathe. He was like blue color, right? So I did a fast intervention in front of a few people, And after 5 and 10 minutes, the breathing normalized. And the day after, the same person, that was a doctor actually, and the same person told me, I don't understand what you've done, but it cured my problem suddenly, right? We can impact on digestive problem, chronic pain syndrome, fibromyalgia, depression, burnout, and drug addiction. 1/3 of my patient in my study for my PhD was drug and alcohol addict, right? Attention deficit disorder, post-traumatic shock syndrome, etc., etc. There is a lot of things that we can do in a lot of different area. I would like you to watch that video of this grandmother. Can we play that? I don't know if it's playing here. Does it play? Oh, it's not playing here. Show my. I cannot play that video, unfortunately. This is a grandmother, 76, 77 years old, that was having chronic back pain. And after 4 treatments, and chronic, I mean like 25 years, she could not walk properly. She was using a walker, and after a few treatments, she stopped using the walker. And of course, she was not using physiotherapy because she lives in a slum area in Sri Lanka, in Mount Lavinia. And after a few treatments, she could walk, and she was very happy, right? So as I said, we are working in conjunction with classic Western medical doctors, but sometimes here in Sri Lanka, when they cannot access health service, the therapist is working alone, right? And we are getting concrete, measurable results, right? So that's the time I had. You can follow me on this website. You can write me at this address. I would like to thank you for your time, because I mean, it's not frequent that energy therapists can talk to scientific community, but we are not charlatan, we are not faith healer, and we are working with classic Western medical doctor, a lot with physiotherapists. And I really, really believe that if we can work together, it's for the most benefit of the patient, right? So thank you for your time. I'm open for question if you have some. If anyone has some question.
Thank you, Dr. Tessier, for introducing a new pain management method to our physiotherapists. Participants,
Thank you very much.
now you can ask questions.
Yes. So you may be curious about what is that. You may be curious as physiotherapists. So if you have any question on any specific cases, I will be very happy to answer you.
Sir, I am MD Saddam Hussain from Bangladesh. I am a physiotherapist. Sir,
Yes.
can mechanical, biomechanical dysfunction in our body, like a bones dysfunction, disc herniation, manage this type of approach?
Yeah. Yes. Very efficiently. I remember maybe 10 years ago, I will give you a case, okay, of a student that was having a very severe disc herniation, very severe.
Yeah.
The orthopedic doctor told him, you have to have an operation, because it was, and he was not very old. He was 26 sports, and the disc herniation, I saw the x-ray, and it was absolutely severe. He couldn't sit, he couldn't walk. It was very difficult for him. So I said, during the time that you are going to wait for your surgery, I will treat you, okay? So for around, I would say, out of my memory, I had with this patient 13 or 14 session, right? And during the session, with the use, we are using the finger because you saw the graphic, right? From the palm of the hands, there is a lot of energy that is projected, but we are using for these techniques the finger, because the finger are using a smaller amount but pinpointed energy, right? And you're not doing any manipulation. I'm not allowed to manipulate. I'm not a chiropractor. I'm just projecting the energy. And even if it is a problem was around L4, L5, right?
Yes, sir.
But I used to adjust the full spine, because if you have the full spine adjustment, the spine is a fluidic structure. You do not just adjust the local area. So for 60 minutes, we are projecting energy vertebra per vertebra. And in some area, we loudly can hear the cracks of the vertebra going on, right? And the pain went from 9.5 on 10 to, I would say at the first session, to 6. The day after, it went up. 3 days later, when he came, it went up and down. You know, there is a fluctuation of pain. You know what it is, huh? In a clinic, you know that you cannot instantaneously heal and cure something. After around 7 to 8 sessions, the pain was very low. And after 13 and 14 session, it was at 0.5. In a way, in a certain, he had to see his orthopedic doctor. And the orthopedic doctor at the end says, well, I don't know what you have done, but you don't need the surgery anymore, right? So I was astonished because I'm not pretending anything. I'm just doing my job. I don't know what is going to be the outcome. However, this operation was canceled. So to answer your question, sir, yes, we can do.
Just amazing, sir. Only 13 and 14 session. Just amazing. Thank you, sir. Thank you.
Welcome.
I have a question. Oh, sorry.
Go ahead, Deborah.
I have a question on the position that the patient was in, and then the frequency of, did you see him twice a week, once a week? What was the frequency?
Three times a week.
3 times a week? And then what? Okay, and then what was the position he was in?
Well, a very difficult position. It was it was very difficult for him to walk. So it took a lot of time. He was using a cane. He was not very old, but he was using a cane. And there is 2 energy therapists are using sometimes massage table for some treatments. So he could manage to go on the massage table facing down and using the hands-on techniques. And then after, there is other techniques, 30 other minutes that I've used where he could sit on a chair, and then I was facing the back and using the fingers. But at the beginning, it was taking him so much time I suspect that there was more than just the spine. I suspect that there was a sciatica problem also, because he was having pain into his legs as well. And so at the beginning, it was very, very difficult for him to sit but after the 6th, 7th session, the pain was sustainably less. But the amazing thing is that the orthopedic doctor canceled the operation, says you don't need anymore, right?
So that is really, really amazing. So when he was laying on his stomach on the massage table, do you consider any type of radiating pain or anything like that? Do you position with pillows?
Yeah, definitely. Yeah, I had to put a pillow on the abdomen. I was actually putting I had some smaller pillow, shoulder, so that the shoulder is not like this on the massage table, right? So that the
Yes.
shoulder can have the spine even, right? Actually, this is my physiotherapist that teach me this. After that, I was using one pillow under the belly, and also the foot, to the ankle. I was putting two smaller pillow onto the ankle. So it was really like the spine was even, I took the time to install him comfortably. So you have to, it's slow, you know, the intervention is very slow. It is very, very slow, right? You have to take care of the patient, and it takes time. You move slowly in that kind of cases, right?
Do you have, do you do any cueing as far as his breathing, or do you play music or anything like that?
Yeah, I do, definitely. Breathing, well, the therapists are using breathing. We are using breathing because when we breathe in, we inhale, and like in Qigong, same thing. We inhale the prana, the Qi. And when we are breathing out, we are pushing away the used up energy. So I've teach him to self-heal the pain as well at the same time. So this is more than just muscular relaxation, but there is muscular relaxation, doctor, definitely. But there is an energy factor because you are exhaling. When you exhale, and when you exhale and you visualize that you're exhaling the physical pain, the phenomenon happens. You exhale the pain. You inhale healthy prana, you exhale the pain. So yes, I did that, doctor. I did that.
Was he to follow through at home with any of this? Laying down and breathing?
Yes, he did that home. He did because the pain was so high, and he did manage to I would say reduce. But you know, herniation is very acute. It's very like a knife in your back, right?
Yes.
It's very, very, very much acute. The same thing with scoliosis as well, right? Scoliosis, I did not saw the result of the X-ray, but I had, I would say, I had a lot of patients that, you know, there is sometimes disc herniation that accompany the scoliosis, right? Because of the position of the spine, right? There is definitely a curve like this. And sometimes there is, as you may know, doctor, there is a herniation that happens at two different places, right? So same phenomenon, but we work in a different area. We work on the full spine, and we can see. I'm not a physiotherapist. I have no X-ray. However, I can see. I can compare with the previous session that the accentuation is less. But we need stronger evidence. I did not have the chance to verify that with X-ray, because these patients were not followed by physiotherapists always. Sometimes they are, sometimes they are not, right? It depends on each patient. I like when they are followed by physiatric doctor or chiropractors as well, right?
Thank you very much.
Thank you, doctor. Thank you. Any other question?
Doctor, I'm Kumar.
Yes, doctor.
I want to how to activate the energy power to any person. Are there any special method or?
Yes. Yes. We are an antenna. Okay. So you need to understand that naturally you every day receive, inhale, and exhale, right? So the first techniques is there is different breathing techniques. We are the breathing is the twin sister of prana, of chi. Even in acupuncture, when the acupuncturist train the patient to breathe appropriately, the prana, the chi, circulates faster into the physical body, right? And there is, even for myself, even for the therapist, breathing techniques that accumulates the prana, and then you can project this prana. You breathe in, you receive, you breathe out, you project. So this is what you learn. You learn how to accelerate also the speed of the prana, because the physical body of everybody naturally attract the energy. But the trained therapist, is accelerating the amount, is like putting it on a turbo, right? We are putting the amount of energy a lot by the speed, but by the breathing technique, sorry. So this is like breathing, basically. The intent also, as I said, the energy follow the will, and this is very surprising. But if you instruct the energy to go faster, it will go faster. If you instruct the energy to go at that place, it's going there. And it's not, I mean, it's a natural phenomenon, right? You do not have to think so much. You just have to like use your eyes and tell to the energy to go there. And when you work in energy healing, you don't work the eyes closed. You work with your eyes open and you focus exactly where the energy has to go, and suddenly it happens, right? I hope it answers your question, Kumar.
Yeah, other thing, then how to know our energy is working and our energy is activate and anything?
You feel
because
it.
No any feeling.
When you scan the energy, you will feel, okay? If you have few seconds, everybody, put your hands like this. This is Qigong, right? Qigong, you are trained to do this. If you're putting your hands like this, the more you are putting your hands closer and closer, you will feel something in the palm of your hands, right? If you breathe, you will feel that like the balloon, the ball that is there is becoming bigger and bigger and bigger. I don't have the time right now to give you the full training, but with the breathing exercises, you are accumulating a lot of energy. And we are training the therapist to feel it with the palm of their hands, right? And the more the more you're putting your hands closer and closer together, the more you feel that you are accumulating energy. And the more energy you have, the faster your treatment is, the more efficient your treatment is. You're not using your energy because you're going to become depleted, right? So we are training the therapist to activate and speed up.
I'm hearing normally energy therapy is treating per 1 day 2 patient or something. Are they as true? Because some people say after the more patient treating, the healer's energy is waste and something to
because it's using his own energy. You don't use your own energy. You are using the channel, you channel the energy. If it's like this, it's because the therapist is not trained to attract and give. He's using his own energy. You understand? You have to, in my training, I train the people, the students to attract and give, not your energy. You are going to become depleted and very tired. You understand?
Yes, thank you very much, doctor.
My pleasure. Thank you for inviting me anyway, because it's a unique occasion that I have to speak with scientific therapists, and I hope that in the future this kind of event will happen more oftenly. Thank you very much.
Good morning.
Thank
Good
you.
morning, sir.
Yes.
Hello. It's like how do we heal the psychological issues like anxiety,
Yeah.
insomnia, OCD. How do we
Yeah.
heal this with this?
How? You have to train. You have to receive my training. Well, there is protocols, right? There is different protocols. I cannot enter into the details of that right now, but I can definitely tell you that there is OCD, there is a personality disorder, there is a schizophrenia. A lot of patients that came to see me were suffering from schizophrenia, insomnia, and this type of energy is different, right? When we have arthritis, the energy of arthritis is more dense, I would say. The density of the chi, prana, that we feel with our hands is dense here. The energy of psychological disorder is different, is a more subtle energy. So it is, we train the therapists to make the difference between these two conditions, right? And they can remove, because it's a contamination. When you have an emotion, it also impacts the non-physical body. So it is almost like the same technique, but with some differences, because a pain impact in the non-physical body. If I have a pain in my wrist and I passes my hands over here, I will feel, right? If I have an emotion, I will go to the solar plexus chakra, to name it, and I will feel that there is something. The vibration of this is not normal. So what we do is we clean this dirty energy that is there, and we replace it, and the stress level minimize very, very fast, and sustainable also. I had a lot of psychological condition into my patients previously. Now I am more teaching, but that's a very, these issue can be addressed very easily. But don't talk about miracle, right? People confuse us with faith healer. No, it takes some time to completely cure, like schizophrenia. We can minimize their condition. So I just left my WhatsApp number here. So if you want to have more questions, you can WhatsApp me, right?